Welcome, and thank you for joining us for the Creative Healing for Youth in Pain, or CHIP, webinar. Our topic today is developing an individualized treatment program for chronic pain. I'm Dr. Shelley Siegel. I'm a clinical and health psychologist, and I have a private practice in Calabasas, California, and I'm on faculty in the Department of Adult Psychology and the Health and Behavioral track at UCLA. I began working with CHIP's founder, Dr. Lonnie Zeltzer, when I finished my postdoctoral fellowship at UCLA in 2004. I continue to collaborate with her and our multidisciplinary team and have been working at both Whole Child LA and CHIP with the decommitment to mind-body well-being. Our speaker today is Dr. David Schechter. He's a physician in West LA, California. With over 35 years of experience as a family and sports medicine physician, Dr. Schechter specializes in mind-body medicine, preventive medicine, and chronic pain. Dr. Schechter attended Princeton University, received his MD from NYU, did his residency through UCLA Santa Monica, and is an attending physician at Cedars-Sinai Medical Center. He's written several books, including Think Away Your Pain, the Mind-Body Workbook, the Mind-Body Workbook for Teens, and the Lessons Dr. Sarno Taught Me. He's co-created an online program called the Mind-Body Healing Journey and co-authored the Mind-Body Workbook, Volume 2, and a diagnostic guide for psychophysiologic disorders. Recently, he created a course, Mastering the Mind-Body Connection for Teenagers. Before we begin, I'd like to review a few housekeeping items. First, please enter your questions in the Q&A throughout the webinar. I'll incorporate audience questions in today's conversation. The chat is open for discussion, but I can't guarantee that every question will be answered. Finally, please consider making a $25 donation to CHIP if you find our monthly webinars valuable. Donations can be made to mychip.org/donation. This link will be in our chat. Now we're about to begin. Thank you for joining us today, Dr. Schechter.
Thanks for having me.
I'd like to start by asking you how you initially got involved in the field of pain.
Well, it was because of pain that I was experiencing myself. I was a medical student at NYU, and my recreation, my way of reducing my stress from school was running and basketball. And when I began to have knee pain, it stopped me from doing those things, which became very frustrating and obviously didn't give me the physical outlet that I desired and needed at that point. As a result of some fortuitous circumstances, I ended up visiting Dr. John Sarno in his office at the Rusk Institute, and he talked about this novel approach to pain that he took with his patients, and that's led me down the path toward treating patients for the last 35 plus years.
And that seems like he was a big, he was a mentor to you, it sounds like, and you've really used his work to guide yours.
Yeah, well, Dr. Sarno, I mean, the first thing was that he had office visits and seminars to teach patients. It wasn't just the typical consultation. He did seminars and teaching sessions, which I attended, and I found that my pain was able to dissipate and go away, and I was able to get back to my activities as a result of attending these sessions. And this was before he had written his first book. And so learning from him about how to get rid of my own pain led me to seek out a research grant to spend more time in his office, which included seeing patients, but also doing a research study. And I began to hear the same kinds of successes from the people I called in the study as I had experienced. So it wasn't just me getting better, it was lots and lots of people that he treated. And so that was very influential to me. And it was very integrative, you could say holistic, obviously psychologically minded, and it was different than the technical knowledge that I learned in medical school. And I found it very interesting and intriguing.
The mind body, right? Can you tell us a little bit about your practice?
Well, my practice consists of both general medical patients, because I still do adult family medicine and I still see sports injuries. But a lot of people seek me out for chronic pain, for pain that has not improved despite assessments and treatments by both conventional and alternative practitioners. Many of them have back pain, but some of them have headaches. Some of them have pelvic pain, abdominal pain, other causes, again, without a clear biochemical or structural cause. And I see those people in a consultation, and then I help design an individualized treatment program to get them out of where they're stuck. Because I find that many of them are stuck. Many patients with chronic pain are stuck in a loop, in a cycle, and they can't get out of it. And the system seems to almost suck them deeper into it. And I find that my job is to often deprogram them from what they've heard from other well-meaning practitioners who may be misinforming them, and to get them moving in the right direction.
Sounds so interesting. So you have a collaboration then. It's not you working alone. It's working in tandem with other healthcare practitioners. What might that include? What type of
It'll
healthcare
depend on the
practitioners?
patient. You know, I start with the initial consultation with myself, and I usually recommend some educational materials, which may include books and workbooks. And you mentioned some of the things that I've written, websites, movies, podcasts. I want to get them educated because, John Sarno taught me that education is often the penicillin for chronic pain. When I find that there are deeper psychological issues to address, I do not hesitate to refer them to a network of psychotherapists and psychologists that I have worked with over many years now, who have expertise and interest in this area. And by working with that therapist as well as me, we're able to kind of get them from a couple of different angles, so to speak, and help them to heal. And again, I tend to move people away from some of the physically based treatments that might include, physical therapy or acupuncture.
Mhm.
Most of them have already done that for quite a while. And I try to move them more toward the psychologically based treatments, but I am an advocate for physical activity and exercise, just not so much for physical treatments in many cases. And again, it's individualized, so not every patient gets the same approach.
Correct. So lifestyle is another part of your treatment protocol, I would assume, when you say exercise.
Yeah, when people are in chronic pain, they've tended to withdraw from the world, they've tended to withdraw from physical activities. And one of the ways of helping them to break the cycle of pain is to use graduated activity or graduated exercise. So, an example of this would be someone comes in and says, I used to walk 2 miles a day, and now I don't even, I just barely walk out to the car and go somewhere if I have to get groceries. And so I say to them, well, let's start with a walking program. How about if we start with 5 minutes tomorrow? Could you do 5 minutes? And they usually laugh and say, I can do 5 minutes. So I have them start with 5 minutes and then maybe add a minute every couple of days to a walking program. And by doing it gradually, they can build up their confidence and they can feel more comfortable that they're not being pushed beyond their capacity. At the same time, psychologically, their body is beginning to get a message that movement and activity is not unhealthy for them, it's actually healthy for them. And that's a big change that they need to make. So, hearing from a physician and a sports medicine expert that they need to move, whether it's walking or swimming or bicycling, stationary bicycle, that really, I think, is a big factor in improvement. And again, it's also just good for you. It feels good to move rather than be inactive.
So mental well-being, again, is a huge part of your treatment protocol. Can you tell us what neuroplastic pain is? and how you diagnosed it?
Yeah, I mean the term that I first learned in my early training was tension myoneural syndrome, the acronym TMS. And over the years, we've looked for better terminology that might be more scientifically acceptable, more medically acceptable. The term psychophysiologic disorder was used for a while in my field, and the preferred term right now would be neuroplastic symptoms or neuroplastic pain. The idea of neuroplasticity is something that's familiar to most people nowadays, which is that the brain and the nervous system can go through changes as a result of different interventions. And in fact, it has that capacity throughout life, even into our very elderly years, neuroplasticity. So the term neuroplastic pain refers to the idea that although the pain seems very entrenched, and I see people with 6 months of pain, but I also see people with 30 years of pain. Nonetheless, there is the capability within our nervous system in most cases to change, to heal. And that change we call neuroplasticity or recovery from neuroplastic symptoms. So that's why we've kind of moved in the direction of that name. There are other terms that are used as well, and that can be confusing to patients, but the basic core concept is the capacity to improve, and that with the right inputs, the right information, the right healing messages, the right activities, the right types of journaling and therapy, that people can get better.
So interesting. How many patients have you seen that have seen multiple practitioners before they end up in your office?
Well, thousands. Okay, so I've counted over 4,500 consultations that I've done in the last 30 some odd years for chronic pain with this approach. And I would say, of course, some may never have seen another practitioner, but the vast majority have seen many practitioners. I mean, some of them come in with a list of 10 to 15 doctors and alternative practitioners they've seen. Many of them come in with what I would call the A list of physicians and practitioners in Los Angeles. And again, it's not that I'm any smarter than these other doctors are, but I'm asking a different set of questions. And this is a key element to why I get a different type of result, right? If somebody was going to get better from physical therapy, they're not coming to me for chronic pain. If somebody got better from a surgical approach, they're not coming to me for my approach because they're better. So it's the people who are not better from both conventional and alternative approaches who are typically seeking out my expertise. And so if I did the exact same thing these other doctors were doing, that would, in a sense, be the definition of insanity, doing the same thing over and over again and expecting a different result. So I'm doing something different. I'm asking them different questions. When they hear from me the question, so what's been going on in your life? Many of them will say, nobody's asked me that. And I don't see how you could have a patient with chronic pain for 5 or 10 years or 3 years or whatever and never ask them that question. But they often indicate that that's something that didn't interest their prior clinicians. And I go to that question as one of my core questions. When I ask them about their early years, their childhood, they often indicate, well, how is that relevant? And I say, well, your childhood is very relevant to your psychological state, your personality, and how you approach things, the whole rest of your life into your older years. And so asking different questions and taking different approaches is, I believe, the key to the success I've had over the years in treating people with recalcitrant chronic pain.
Do you work with families? Do you give them, let's say, materials to read, education like you were talking about? Because pain doesn't exist alone, right? Other
Yeah.
people are affected in your life, your
Well,
parents, your children.
I very commonly have another person in the room other than the patient. They often bring a spouse, a parent, a
Mhm.
sister, a friend, because they want somebody else to be there for support, for learning, to take notes, to ask questions. It can be very helpful for me if they're since that person is in the room, I might ask them a question and say, so this person says they're pretty hard on themselves. Is that something that you find as well? And often that person has even more insights into how self-critical my patient is than the patient themselves, because they see it from the outside rather than just from the inside. So um, I work with the family or the significant others where when the patient desires that, and I work with the patient alone when they prefer that. One of the things that I have a kind of a treatment menu that I work off of now. So I've developed a 2-page sheet where I'll recommend to people certain books to read or journaling, workbooks, podcasts, and then there's a couple of movies that have been made in this area, and some other things on this menu. So I'll often say to people, "Well, here's a movie you should make some popcorn and watch it with your blank, your spouse, your boyfriend, your parents, your child, whatever, because the movie is something that people in the family will typically sit down for an hour and 15 minutes and watch, whereas asking someone to read a book on your behalf might be more challenging. Although I've sometimes had the case where a parent or a significant other has actually read my book or one of the other books in the field, and that led the patient into the process of looking at this approach, and being open to this approach.
I'm just curious, which movies do you recommend they watch?
Well, the movie All the Rage is the one that I recommend the most, and it can be streamed on Vimeo and Amazon Prime, and it's about this work. And then the other movie is Pain Brain, which can be streamed again. So these movies were made by directors in the first case who had gone through the treatment approach. And I make a cameo appearance in that first movie. The second movie was more based on some research that's been done over the last number of years on the effectiveness of this approach, and tries to explain a little more about the brain mind body connection. And so they're both useful. They're neither movie is perfect, but
Right.
there's even one or two other movies that have either come out or will be coming out. But I don't like to overwhelm people with recommendations. I just want to get them things that can be helpful to them. These are the ones I like.
Right. So, I understand not overwhelming someone. They're already overwhelmed when they show up at your office, right?
Right.
What do you think are the core elements to recovery and success of treatment?
Well, I would say from the beginning, being open to a different approach. Right. So sometimes people will come in because somebody said, "Hey, this book helped me," or whatever, and they're not really open to it. And so I try to listen and I try to work with them and I try to help them to be open to it. But ultimately, if someone is not willing to work with me and with this approach, the approach can't help them. So it's different than if you have diabetes and somebody gives you an insulin shot, your sugar is going to come down to a more normal range, whether you believe in it, are open to it, or anything else. The shot itself will, in a sense, not cure, but treat your diabetes. To be treated with a mind body approach, you have to buy into the idea that your mind, your brain, your emotions are playing a significant role in your pain. And if you haven't bought into that, we can work with you on that. Skepticism is fine, but if you're completely closed to it, I usually say, why don't you come back when you're more open to it, you're more ready for it. And sometimes people do come back 3 months later or 6 months later, and they say, I think now I've tried everything, and I'm desperate, and I'm ready to listen to this in a new way. We know that desperation is a great motivator. I mean, we don't rely on that as our only uh, entrance into the treatment process, but many times people who have failed at 5 or 10 or 15 other approaches are more open and more enthusiastic about this approach than someone who has had a shorter course of unsuccessful treatment for their pain or other mind body symptoms.
Do you find, let's say, with teenagers, young adults, because you work with that population too, that sometimes it's difficult with the parents? They don't believe them. They think they're manipulating or they're trying to miss school or, that there are other reasons that they're really okay. And how do you How
Yeah,
do
I
you
mean, the
help with
first thing
that?
I do with any patient, and it certainly applies to the adolescent, is validating their symptoms, right? So the physical symptoms or the experience that they're having, I tell them this is real pain. This is not imaginary, malingering, make-believe pain. This is real pain. It's important for everybody on board to accept and believe that. What I tell them, though, is that all pain is ultimately experienced in your brain and in your central nervous system. And so, why don't we try a different approach instead of bottom up? Because most treatment is bottom up, right? It's physical therapy, or it's acupuncture, or it's massage, or it's something like that. Let's try a top down approach, starting from your brain and working down. So, we're starting from, the mind, the brain, and the emotions. And so, I'm validating the pain is real. I'm totally on their side with regard to that. But I'm just saying, let's take a different approach. The other approaches haven't been successful. Let's start working in this approach. And there are elements to how this is similar to other things, but there's also a lot of elements and emphases that are very different.
Right. Do you also recommend treatments or lifestyle changes or work with mindfulness and yoga and relaxation? Is that part of your treatment protocol?
Well, in terms of yoga, yoga's physical activity, and I encourage physical activity in general. And yoga gets you moving and it gets you breathing. What I don't want people to do is become reliant on the idea if I miss my yoga session today, I'm going to I'm going to have more pain. So I don't want them to become dependent on yoga as a treatment, but I like it as an exercise. You mentioned relaxation. So calming the nervous system is definitely an important part of recovery, but I don't I don't choose sort of the way that they do that. So that if somebody wants to meditate, I'm accepting of that. If somebody wants to go for walks and look at the trees and the squirrels, even in an urban environment like Los Angeles, I'm fine with that. So I think we're finding ways to calm your nervous system and take better care of yourself.
Mhm.
I emphasize, but I don't prioritize one approach over the other. In terms of mindfulness, and there's mindfulness-based stress reduction. I don't believe that cures this chronic pain by itself. And so, in a sense, what we're teaching is a different kind of mindfulness, right? So we're teaching that you're mindful. You should be mindful of what your emotional state is. You should be mindful of your feelings. So that's kind of a slightly different way of
Mm.
looking at what mindfulness is. We're telling people who have been experiencing their pain purely physically that it's helpful to experience and to connect to what the emotion that you're feeling is. So that's the mindfulness that I seek rather than a specific technique that's taught and called mindfulness, derived from some of the Eastern religion philosophies. I'm not against doing those things. I
Right.
just have not found that that's the core of what gets people better.
Okay. So, at some point, I would assume if that you are incorporating treatment with psychologists, psychiatrists as well. Is there med management? Let's say
Well,
psychotropic
yeah, I'm
medication.
comfortable prescribing a lot of medications as a physician, but we don't primarily focus on medication for this approach. In fact, my
Right.
goal in many of the people who are on different types of medications is to help them get off of it as they get better. And I've had great success of that with migraine medicines and pain medicines and other things like that. But again, it's an individualized decision as to who should see a psychologist or a psychotherapist. I refer many of my patients to qualified people in those fields who have an expertise in this area. But again, there are some people who aren't ready for that yet, or there's other people for whom a group session works better. And I have at different points led groups with a psychologist. We did Zoom groups during the pandemic; they were very popular. And there's a company now that I consult with that does some group therapy work in this area.
Mm.
So sometimes groups are more effective or more cost effective. Sometimes individual therapy. The first thing that I start everybody off on is expressive writing, which is journaling. And that's a form of
Mhm.
self therapy, if you will. And that can
Mhm.
sometimes open people up to the point where psychotherapy can be more effective, or where it becomes evident to the patient, hey, there's some stuff coming up that I really want to talk to somebody about. And I don't claim to be a psychotherapist, and I don't do the 50-minute hour after my first consultation. My visits are shorter. And so I do refer people, and I try to really match them really well with a therapist that is suitable for their needs. I'm fortunate to know quite a few therapists in Los Angeles and elsewhere who I know well enough that I can kind of match them usually pretty well with a patient so that they get a good result. And I usually give them two or three names in case the first therapist doesn't have any sessions available, doesn't have any times available, or the schedule doesn't work out for them or whatever. So I usually give them a few names, but I prioritize those names one, two, three, so that they know who I think might be the best fit for them. And I, encourage them to have a brief conversation with the therapist on the phone before initiating therapy to see that they feel like it might be a good fit and they're comfortable with the person. And the yeah, the model is definitely collaborative, team based. We have some people who call themselves coaches now in this field who've become initially. I initially was skeptical, but they've become quite helpful for patients. They don't do psychotherapy in the classic sense, but they work with patients on the day to day or the week to week process of recovery, and they can be a helpful part of the team as well, either in conjunction with psychotherapy or in lieu of psychotherapy. And they're typically people with maybe their own personal recovery story, and often they have a master's in one thing or another related to health education or psychology, but they're not a traditional psychotherapist. So those are the kinds of people that I work with, therapists, some of whom are psychologists, some of whom are MFT or LCSW trained, and then some coaches, and then obviously the home educational programs I find are very helpful, because if you think about a lot of people with chronic pain, they've been treated as if they're the passive player in this recovery process, right? So they lie on a table, they get a massage. They lie on a table and a chiropractor adjusts their neck. They lie on a table and the acupuncture needles get into their body. Um, and they may lie on a table and get an injection from a physician. All of that is very passive. But for many patients healing from pain, chronic pain, and other mind body conditions, they need to get more actively involved in the process. And so I'm looking for things for them to do, like expressive writing, like physical activity, like reading a book,
Mhm.
like watching a movie, where they're really a little more active. You may say, well, movie watching is passive. Yeah, but you're more involved in the process than an acupuncture needle. And again, I'm not against acupuncture for the right patient. I'm just saying that for chronic pain, I find that these approaches where we activate the patient and get them involved in the healing process are more effective.
Sounds multifaceted and uh, about the whole person versus just their pain, right? It's about the whole person.
Sometimes the
So,
most effective way to heal pain is not to think about pain or focus on pain, is to focus on the person with the pain and what is going on in their life and what has gone in their life and what their childhood was like and what they're upset about now and what they don't like in their life. And that's how you paradoxically get rid of pain rather than focusing on pain, which has been tried by usually the other practitioners that have worked with them.
and I agree. I find that people really appreciate having a physician or many healthcare professionals who are interested in them as a whole person. More likely to open up, more likely to want to try new and different treatment approaches, right? Because for a lot of people, like you say, they've seen any number of doctors who are doing procedures and not looking at them as a whole person. Do you, are there any ways, let's say, to inoculate our youth from chronic pain disorders?
That's something that has intrigued me over the last 5 years, because I treat a lot of people in their 20s, 30s, 40s, 50s and teenagers with chronic pain and older people. So I would love to be able to figure out a way to reduce the epidemic of chronic pain and stress related disorders. And so I began to think about, can we develop an educational arm or an educational element going back to middle school and high school where health education is taught and people learn about nutrition, they learn about sexuality, they learn about exercise, but they don't necessarily learn as much as they should. I think it's starting to creep in about social emotional learning. And so I developed a short curriculum with the help of a teacher and a psychologist to try to get this into schools. And it's been piloted a couple places, but we still need more schools to try it and to incorporate it. And I know some of them are trying to do that with mindfulness and with other social
Mm-hmm.
emotional programs. And I'm definitely an advocate for that. What I did is I recorded the school program and made it into an online course for teens because I felt like it could get out to more people, and homeschooling parents could also use it as part of their education. I put in only a small amount of time on this because obviously I'm busy with other things, but I would love to be able to, as you said, inoculate, not with an injection vaccine,
Right.
but with an educational vaccine, with the kind of education that makes adolescents aware that their emotions are affecting not just their mental health, but also their physical health and their physical well-being, and in some cases, chronic symptoms like pain, irritable bowel syndrome, headaches, that sort of thing. And if they get comfortable with that concept, I'm feeling that they may drive the medical profession in the next 10 or 15 years to doing more of this, because it seems like the medical profession is the most difficult field to begin to incorporate these principles into the work of physicians. Psychologists are much more open to this. Therapists are much more open to this. But the medical doctor is still trained in prescribing pills, doing procedures, injections. There's also, in some cases, financial incentives where sitting and listening to someone and validating their pain and reassuring them and learning how to listen to them and learn how to speak to them is not, unfortunately, prioritized in my profession. And so I figured I can't fix the whole profession right away. Maybe I
Mhm.
can teach more of the adolescents, young people, middle school, high school, where they can kind of understand these concepts so that they can push things forward in the future.
I mean, it sounds like a fantastic idea, almost like it should be part of every middle school, high school curriculum that these various aspects of lifestyle, but also teenagers, young adults feel very isolated. They have problems with friendships, I think, are missing school, I think. So the fact that maybe there's a broader understanding and tools that they could have would be fantastic. So you said you've done a couple of those kind of pilot
Yeah, we
programs.
tried it with a program for troubled youth in New York. There was a motivated leader of that. I'm not sure if you call it a camp or what you call it, but he incorporated it into his curriculum in New York. And then we've had one school that has incorporated it as well. Getting for certainly the public schools have a lot of bureaucracy to incorporate any new materials in. Private schools are a little bit more easily worked with, but if anybody on the call today, the webinar, or anybody who listens to this in recording is in the educational system and would like to discuss it with me further, I'm very easy to reach in Los Angeles. So I would love to talk to principals, school psychologists, teachers, health education teachers, and others, even homeschool parenting parents. I'd love to talk to any of those groups and see if I'm not charging you for the program. So I mean, I'd love to see if we can get that program used in more places and eventually become more of a standard as part of the curriculum. Remember, it doesn't replace your health education curriculum. It's
Correct.
just like 1 week out of it or 3 days out of the curriculum where the emphasis is, and the PowerPoints are already done. There's a teacher's manual. So we're quite a bit along the way, But again, I don't have the infrastructure to, in a sense, market this to schools and push it along. So perhaps people listening today or who listen on the recorded version will be able to make suggestions on getting that information out to more young people.
I think it sounds fantastic. I mean, really, so much value to that. And just making it more open too. Let's say teenagers, adolescents are not so happy about sharing how they're feeling, right? That is another way of isolating themselves. You said you have groups. So are they psychotherapy kind of groups?
Well, the groups, and I'm not currently doing them. I took a little bit of a break
Right.
with the psychologist that I was working with, but the groups I would say are a cross between um, education and group therapy. I mean, we do the basics of the group. The psychologist is trained in group therapy, and we do the basics of group therapy in the sense that people talk about how their week went and how they've incorporated some of the principles, and then we try to do a little problem solving, and then we give little snippets like a 5 minute mini talk during the 90-minute session. So we've tried different approaches. People have liked them. Fortunately, people get better and move on, or they want to work more individually with a therapist, and they feel like they can't do the group and the individual at the same time. So there's been different reasons. During the pandemic, there was a the laws for physicians seeing people in other states, it was very much loosened. So I
Yes,
would
it
have a
was.
group where we'd have people from, 3 different time zones, and it made it easier to have a sufficient number of people to make the group viable. It's been a little harder since the pandemic emergency ended. I'm glad the pandemic emergency ended. It just made it a little harder to keep the group going.
What changes have you seen in over the years since you started? I mean, I just want to say that initially, so I graduated in 2004, and the mind body was really starting to take off, attachment theory with Dan Siegel and his whole group and all of this. But I'm wondering what it's been like over the last 40 years, the openness and the changes.
Yeah, there's been a gradual improvement and increased awareness and increased discussion in the media of the importance of mental health, the importance of psychological factors in healing, in pain. There's more awareness of this even in the medical profession, certainly. But it's been slow and it's been a little bit frustrating as as a physician who's been in this field for so long. I've sometimes felt that I was banging my head against a wall, and you desire to stop doing that. And but what's happened? There's more practitioners practicing sort of the way that I do. There's more therapists getting training. There's a national movement. The current name for the movement is the Association for the Treatment of Neuroplastic Symptoms, ATNS.
Mm.
The website is symptomatic.me, and it's a nonprofit. I'm on the board of directors. It was previously called the Psychophysiologic Disorders Association. Just to give you an example, 15 years ago, we had a meeting in Michigan, and there were 30 attendees to the meeting. These were physicians and therapists, mostly from the United States, one or two from England. And we had a meeting in September of 24 in Boulder, Colorado, and there were 360 attendees. So a huge difference between 30 and 360 over 15 years. This time it included physicians, many therapists, coaches, a few patients, and miscellaneous other folks. So it was really tremendous amount of growth. We're having another conference again in Boulder, I believe in October or the end of September,
Mhm.
and I'll be speaking at that one as well. So we're seeing national and international growth. I guess I'm impatient that it happened more quickly. And as I said, there are challenges with the medical profession um, in terms of pushing this forward.
Okay. So there's a question from the audience. How do you get a teenager to journal if they don't write and want to write in a journal? And I guess to add on to that, how do you work with an unmotivated patient?
All right, so let's start with a teenager and journaling. So first of all, you know that saying, the perfect is the enemy of the good. So I would be very, very reasonable in my expectations about a teenager. So I would certainly show them, depending on their age, I might show them my adult version of the Mind Body Workbook, which is suitable for people 17 or 18 and above. I also have a workbook for teens that's much shorter and that sort of teaches them journaling, as well as giving them an opportunity to explore emotionally. So there's a few different options that I have. But even beyond that, let's say you gave them an index card and you said, I just want you to sit down for 2 minutes and fill up both sides of this index card, not in very large writing, but in writing on the lines, with your feelings. And then at the end of doing that, show it to me from a distance and then tear it up. Nobody has to read it. So that gives them sort of permission to write without the feeling that their privacy is going to be intruded, right? So
Yes.
just even an index card, it could then maybe if they start liking it a little bit, you can give them a piece of paper and say, write on the front of this piece of paper or type on your computer and just show it to me from a distance, just so I know you've done it, and then erase it or delete it or burn it or tear it up. You can also have them keep it if they have a private spot or a locked box or place you can't find easily. Let them keep it. It's good to sometimes refer back to it. I'm not saying that all journaling has to be disposed of. Another thing is that the phones have voice memo, and there's research on journaling that the most effective way to do it is writing. But actually, it's not ineffective. It's actually pretty good if you record it as a voice memo. And so you can have the teenager sit in a room and press voice memo and talk about their feelings and angers and frustrations and do that for 3 minutes or 5 minutes, or maybe they'll talk for 10 minutes. And then at the end of that, they can save it on their phone with their password. You never get to listen to it, or they could delete it if they want. But these are alternatives to journaling, right? So there's writing, there's typing like in a computer, there's voice memo. Journaling doesn't end up being effective, according to studies, just thinking the answers. You have to do something with the information. But again, I would be willing to accept very short responses, not one line like a 4-year-old, but like an index card. I would be willing to accept a page or half a page, voice memo, 5 minutes, 3 minutes. And again, they may end up liking it after a while. They may find that it's look, there's AI now that there was a study came out recently for the elderly that they have a chatbot that reduces loneliness in the elderly by chatting with the language model, right? Some of you are more familiar with AI and chatbots than others, but so we may have in the next year or two, who knows? We may have a journaling opportunity for teens to interact with an AI. They're getting more and more comfortable with computers, of course, and AI. So that could be another way to do it. But the idea is to get the thoughts and feelings out of your head onto some type of paper, computer, voice memo, and in so doing, to become more aware that there's an emotional life going on in there, and that keeping it in there is usually more harmful, if you will, than getting it out. Getting it out to a good therapist like Shelley, getting it out to a doctor, getting it out to a friend, a parent, or a teacher. And the self therapy way of doing that is journaling. So I hope that answers your question, Rivka, on teenagers and journaling. If you have a follow up, feel free to ask it. And but that's how I address the recalcitrant journaler. But it is a really good technique to use, and it's very inexpensive and quite effective. There's been hundreds of papers in the last 30 years written about the effectiveness of expressive writing, or we call it journaling, for a variety of health conditions, depression, anxiety, pain. A lot of papers have been written with the benefit.
PTSD too.
Yeah,
Just writing.
PTSD. Sure, absolutely.
Definitely. So you mentioned AI, so this may seem a little off, but there is AI, which is helpful, right? It has a number of tools, but
Yeah.
I think the ability to have what is called authentic intelligence, right? A person,
Mm.
because I think kids now are isolated anyway. They're with their friends, they're on their phones, they're doing things on AI, but it's about real connection between people. So, what are your thoughts on that? I mean, I think the AI, as far as, you know, journaling or whatever it might be, creative, anything, creative writing, but integrating it with real humans.
Yeah, when I talk to adolescents, I'm really looking to see what their lifestyle is like. Are they on video games all the time? Is that their only connection with their, friends? Um, I think that encouraging our young people from a young age to do things where they're interacting face to face, that it might include sports, that could include other types of games. Obviously, any kind of socializing. Summer camp tends to be a good thing because most usually phones are taken away in summer camp or kept off most of the day. And so I'm a big believer in authentic connection, and I'm not in any way implying that AI replaces all the other things that we have. I'm just looking in the case of journaling, I'm just looking for any way to get somebody into something who struggles with it. But what a lot of our adolescents need as one of their key therapies, I said a lot of our adults need more physical movement to get out of pain. A lot of our adolescents need more connection with other people and social interaction to get out of their pain. And sometimes that can be difficult, right? I'm in pain. I don't want to go out to a party. I don't want to go out with my friends. But, well, go out for half an hour. I'll pick you up if you're not having a good time or whatever. Try a short while, right? So these are how you get people maybe just trying some things. Even if you have to sometimes incentivize or bribe them. I don't know how people feel about that, but I mean, if you go to the party for an hour, I'll give you $10 you can spend on something else. If you have to. If you have to. I'm not saying that bribing is my first choice, but incentivizing sometimes gets people out of their stuckness. And teenagers, whatever they're motivated by, can be helpful.
Rivka wasn't sure if you talked about chronic pain being genetic.
So I would say that chronic pain is not genetic. I would say that patients who come in with a family history of chronic pain, I don't want them to feel I don't want them to feel like, oh, I'm going to get it too because my mother had fibromyalgia or my grandmother had it. I want them to believe that whatever previous people had, that there are new techniques, there's new knowledge, there's new skills to overcome it that weren't available to prior generations. However, there also, there's two ways that things are passed along in a family. One is genetic, and one is the cultural experience or the
Mhm.
family experience. And so it could be, for example, if there's a tendency in the family to be very self-critical. Self-critical is one of the personality traits that I often see in chronic pain. I can mention some of the other ones that we call the type T personality, but if
Mhm.
there's a tendency in the family to be very self-critical, and that gets passed from grandparent to parent, and then perhaps on to child, then in that sense, right, there's a family history of self-criticism that maybe leads to worsening migraine headaches or fibromyalgia, and that we can learn from this and maybe start breaking the cycle and teach the child skills to deal with the tendency to be self-critical, whether you believe that tendency has a genetic element or whether you believe that
Mhm.
tendency is more of a family trait or personality style in the family or a cultural thing. We can start trying to break the cycle, right? So, like if you said to me, and this is a terrible example, but also maybe it
Mhm.
is not so terrible. If you said to me, is child abuse genetic? I would say to you, I hope not. And I do believe that in every generation, there's a chance to break the cycle, right? If you were abused and you get the right type of therapy and you get the right, that you can become not only healthier yourself, but you can break the cycle of abuse in your family. Obviously, chronic pain, a different thing, but I'm just giving the example of, because there's two teenagers in your family with physical symptoms that may be related to emotions, it doesn't mean it's genetic or it's permanent. And it does mean that with the right treatments, that hopefully they can both break out of the cycle of chronic pain and live a fuller life, live a healthier, happier life. So those are my thoughts on the genetic. Now, they say migraine headaches are genetic in some cases, but I've had patients who've said, "Oh, my mother had migraines, and my aunt had migraines, I have migraines," but I've managed to get them better with an educational, psychological, mind-body approach. So what does that tell us? You might have a predisposition or
Mhm.
a tendency in your family to get migraines, but it could be that those migraines, and we know a lot about the mechanism of migraines, and there's clearly a physiological process that goes on, but that doesn't mean that with the right techniques and approaches, which include psychological, educational, mind body, that you can't break your cycle of migraines and minimize or eliminate, in many cases, your headache cycle, or interrupt it without the use of medications in some cases, psychologically, even though there's this predisposition in your family. So, right, so genetics and environment interface, and the genetic expression of different things depends on our environment and how we deal with things. So I hope that's helpful, not too confusing. If Shelley has other questions about it, please ask me if I wasn't clear.
No, I think you were very clear about that there may be a predisposition versus a genetic component. I mean, there are some diseases and disorders that are genetic, but we're talking about chronic pain, and I would agree with you on that.
Yeah.
I wanted to follow up. I think what I see often is this negative self-talk. I'm never going to get better. When someone feels better, oh, it's not going to last. I use an example. This is just what I use, and just want to know your thoughts on this. Of, let's say, those pro athletes who are in perfect shape at the end of the season, the pitcher's throwing 100 miles an hour, and they're done with the season, and they don't throw for 2 or 3 months. They don't start back again throwing 100 miles an hour. So it's having patience and trusting your body and listening to it. What are your thoughts on that?
Well, you said a couple of, I think, important things. Um, and your first point, I was locked onto, and then I moved on to
The
the, what was the very first part of your question?
negative self-talk. Oh,
Yeah,
I'm
so
never going to be
self-talk, yeah,
better.
thank you. Self-talk is something that I really work with patients a lot, and then I'll come back to the working gradually, like with the pro athlete. But self-talk, people with chronic pain and people with other mind-body disorders and people with other emotional health disorders often have a lot of negative chatter going on in their brain. And throughout the day, they're talking to themselves, and they're chattering, "Oh, I'm never going to get better, and this is awful, and I'm going to end up in." Some people think they're going to end up in a wheelchair, and so there's a lot of negative chatter. So we use affirmations repeated to yourself as one of the techniques to break that cycle of negative chatter. And strangely enough, pro athletes often use affirmations. If you've heard of golf, there's swing thoughts. For putters, they work with sports psychologists to figure out the perfect thought to have, or lack of thought, as you're approaching the putt that you're trying to win a golf tournament with, or as you're trying to hit a pitcher throwing the ball 100 miles an hour. So it's not that you fix everything psychologically by thinking positively, but it doesn't hurt to start thinking a little differently. So one of the self-talks that we work on, and I have a bunch of affirmations in my workbook. I have affirmations that I've contributed to an app called Think Up that you can download for free, and then has other features, but you can download it for a week for free and read the affirmations. But an example of that would be talking to somebody with chronic pain who I've determined doesn't have a severe biochemical problem like rheumatoid arthritis. They don't have a horrific disc that's pushing on a nerve and causing weakness in the leg. But I've really determined that their problem is more functional, it's more soft tissue, it's more mind body. So one of the ways I can get them to start changing that chatter is to develop affirmations, and I'll sometimes encourage them to develop their own, but I'll give them some tips. So a tip would be, I'm healthy, I'm strong, I can heal completely from this pain. Right? So that would be a simple one. It's not incredibly creative, but it's very important because it gives your brain a different message than it's usually hearing. Okay, so another one would be, I can heal, I'm resilient, my pain is due to stress, and I'm learning to cope. Right, so everything about, there was no no's in that statement. It was present and forward thinking, and it was truthful. Sometimes people say to me, well, I don't totally believe it. And I say, well, there's a lot of, sometimes you have to fake it till you make it in psychology, but I don't want you to say something that's a lie. I wouldn't give you a lie to say to yourself. It's just things that you don't yet fully accept about your healing process. And yet it's a truthful statement that you are resilient. And I try to find elements of resilience in their life, things they've overcome. You are resilient. And look, you're a healthy person. You've had a general checkup by your doctor. Blood work is good. You're a healthy person. You're not a sick person. So I'm trying to give them things to build off of so they can build from I'm strong and healthy and resilient, and then they can build to that, and my pain can go away completely, right? So it changes the self-talk, the negative chatter that you addressed in the first part of your statement. And then the second part of your question about the pro athlete who takes a couple months off after pitching, yeah, they don't go right out and throw 99 miles an hour, or some of them will do that and get injured. So they have a series of exercises, ramping up exercises. And that relates very much to what I said before about, if you were a swimmer, but you're afraid of swimming because it hurts your back, well, don't start out with a mile swimming. Start out with 5 minutes in the pool. Maybe do backstroke because you usually do crawl, and backstroke you don't associate with backstroke with your back pain. Or do butterfly, not butterfly, do breaststroke because it's like the easiest kind of floating through the water, pushing the water out of the way. So there's ways to ramp it up that can be very effective in breaking the cycle of fear. So we haven't addressed fear yet in this. We've talked for a while, but we haven't addressed fear as an important concept. We have addressed briefly the idea of safety and resilience. So calming the nervous system, reducing fear. I mentioned before deprogramming, but I didn't go into further effort on that. But there's a lot of things that doctors, specifically medical doctors, say to patients that I hear from the patient is really stuck in their head. It's stuck in their head that they're not going to get better because this doctor said something. And I first of all explained that doctors are physicians, not prophets. And we're supposed to give medical advice, not prophecy. We can't predict the future. We're very good at telling you where you're at now in many cases. We're not very good at telling you where you'll be in the future, especially when doctors drop these bombshell negative comments that really aren't based in structural, biochemical, imaging, or any other reality. They're just something that they say is stupid. And so I'm reprogramming them, and I'm looking at MRIs, and I'm examining them. That's a role that I have as a physician in this process, to really emphasize, well, you have MRI findings, but they're typical for somebody who's 45. Or, so what? You have a bulging disc. Many discs just shrink over time. Yeah, I don't believe it's really the cause of most of your pain. And so there's lots of ways to work on language and fear. And affirmations is one. And just, having a doctor who listens to you and understands where your fears are coming from. And sometimes they're coming from childhood. Sometimes they're coming from your work environment. And sometimes they're just coming from stupid things that people have said to you about your pain. Sometimes well-meaning people, perhaps, and sometimes poor communicators. And so that needs to be addressed. And I use the term deprogramming because I feel like there's a cult sometimes of some of these statements. So
I
anyway,
think
thank you for listening to that long monologue. Yeah.
I think these are great takeaway points for our audience. And I just want to thank you. This has been so informative, so um, rich with information on a treatment protocol for pain that doesn't just include one treatment or one way to make someone better, but the mind body approach and any number of your techniques, the journaling, the affirmations, the lifestyle changes, I think really all make a difference for our patients. So I thank you so much for speaking to our group today. I just want to finish the webinar by reminding you that our audience that CHIP webinars are available at our CHIP YouTube channel. And again, just make a reminder that if you'd like to make a donation of $25 to CHIP, you can see on the chat where you would go to make this donation. It's really been my pleasure to talk with you, Dr. Schechter. It's very informative, and I can see how your patients improve and have a much better quality of life after working with you and your team.
I
So
enjoyed speaking with you
yeah,
today. Thank you very much for having me.
thank you so much.